Thanks for taking an interest in appropriate appointments online. This tool has revolutionized practices in England and can do the same for practices in Scotland, Wales, and Northern Ireland. Over the next few minutes, we'll walk through exactly how it works and what it can do for you and your team. Studies suggest that up to 20% of GP appointments, that's 1 in 5, could potentially be better managed by other healthcare professionals. But do you know how consistently your care navigation team directs patients? That's exactly what we're looking at here on the screen. Appropriate Appointments Online helps you discover and understand the variations in how your team signposts patients, ensuring every patient is seen by the most appropriate member of your practice team. Let's dive straight into the interactive simulation. As you can see here, we've designed this to be incredibly straightforward for your team. Each team member spends just 10 minutes reviewing 30 realistic patient scenarios. Here we can see the types of scenarios your team will encounter, everything from urgent presentations like chest pain, through to routine health checks, complex cases requiring clinical judgment, and simple administrative requests. Let's look at this scenario. A patient calling about a persistent rash. Notice how the system presents the key information clearly. For each scenario like this, your staff make 3 decisions: who should see the patient, how urgent the appointment should be, and what other services might be appropriate. As we click through, you can see some team members might direct this patient straight to a GP, others might suggest the practice nurse, and some might recommend the local pharmacy first. Each choice is captured here in the system, building up a complete picture of how your team approaches patient care. Once your team completes the simulation, you'll receive a comprehensive report showing exactly where variation exists in your signposting decisions. And guess what? You can also get your clinical team to do the simulation, and the report will highlight any variation they may have, which is a great starting point to have a discussion around why and what could be done to help reduce it. After all, we want patients signposted to the right person, but we also want the patient to get the best outcome from a clinician. This report reveals patterns, variations between team members, and opportunities that you might never have spotted otherwise. It breaks down the data by staff member, by scenario type, and by decision outcomes, giving you everything you need to understand your team's approach to patient care. The tool also allows you to collect data for a week to understand what your percentage of inappropriate appointments are. The practices using Appropriate Appointments Online are seeing remarkable results displayed right here in their analytics: optimized GP capacity, reduced waiting times for urgent care, improved patient experience, and increased confidence in signposting decisions. Most importantly, they're establishing a consistent approach that makes better use of all their practice resources. As you can see, Appropriate Appointments Online works seamlessly alongside our other tools, like the Demand and Capacity Optimization tool, to give you a complete picture of your practice efficiency. This isn't just about identifying problems. It's about empowering your team with the insights they need to make lasting improvements. Ready to understand your signposting variation and create a more consistent approach across your team? Get in touch with our team at info@develop-consulting.co.uk.